Hi, everyone. I think most of you must be familiar with face coverings, especially during the COVID-19 pandemic. So today I'm going to talk about the effectiveness of using face coverings to mitigate the transport of particles from coughing. As we all know, respiratory droplets can be one of the major routes of human-to-human transmission during COVID-19, and the virus-laden particles were found less than 5 micrometer, pretty small in the air, and many of them can be viable and suspended in the air even for hours. That's why we use face coverings, try to reduce the particles inhaled and expelled. Many previous studies have focused on the inward infiltration efficiency of face coverings, but there's still a knowledge gap about the effectiveness of using face coverings to provide the outward protection, which is the ability of face covering to mitigate the outward transport of respiratory droplets, especially in an indoor environment where people spend most of the time day in. So this study aims to evaluate the effectiveness of different face coverings to reduce cough droplets at 0.3, 0.9, and 1.8 meter away from coughing source. We hypothesized particle concentration decrease along the distance, and the different face coverings provide different abilities to reduce the particles generated by coughing. Here's a schematic diagram of the sampling settings, and we monitor the particles 1 minute before coughing as a background, and also 2.5 minutes during coughing and 1 minute after coughing. So during coughing, we have one volunteer generate every cough per 30 seconds, and we repeat the protocol for 3 times, and then we have a total of 15 coughs for each face covering conditions. And we place APS and CPC at 3 locations from 0.3 meter to 1.8 meter to monitor the particle number, concentration, and particle size distribution ranging from 0.5 to 20 micrometer. And in addition, we measure the peak flow rate of the coughing generated by the volunteer. Here's some indoor dimension and climate information. This is like a typical room with a large dimension, and we well control the temperature and relatively humidity and the air change rate, which provide a quite amount of ventilation at 2.31 per hour. Here are the 10 face covering conditions we tested. So first, we just let the volunteers sit in front of the instruments without wearing anything. And then we also test certain masks, including cloth masks and surgical masks, as well as the face shield. And plus, we also combine face shield together with the cloth mask and the surgical mask, try to see the combination effects. In addition, we tested the N95 respiratory and the KN95 mask. Here is the particle number concentration results when there's no face covering. And then we can see during coughing at 0.3 meter, the cough droplets immediately increase to even reach around 400 particles per cubic centimeter, and then decrease to near background level within 2-3 seconds. When the sampling location moved to 0.9 and 1.8 meter, and the particle levels reduced to 47% and 10% respectively of what was measured at 0.3 meter. And we also found particles travel from 0.3 to 0.9 meters, spending about 4 to 26 seconds. And similarly, the particles took about 10 to 30 seconds to travel from 0.9 to 1.8 meter. The reason why the particles spend a wide range of the time to travel is because when the particles expelled by the volunteer, it got evaporated quickly and likely shrink into smaller size. Once it's becoming smaller, it's dominated by diffusion movement, and that can be heavily affected by the environmental flow, which is related to the ventilation condition. And it should be noted, the average peak flow rate of the coughing in this study is up to 20 liters per minute, which is way lower than those reported in a previous clinical study. And those patients generated the coughing flow rate up to 200 liters per minute. That's why we should be more cautious about our results and take the information being more conservative. And we also, for these 10 face covering conditions, we calculated the particle reduction rates, which is the proportion of the particles reduced by face coverings relatively to the particles where there's no face coverings. So these can provide the information about how effective a face covering can mitigate particles generated from coughing. And we see compared to no face covering, the face shield by itself doesn't provide a good efficacy because the particle reduction rate is only about 4%. But better than that, the cotton mask, flannel mask, and their combination with face shield give a much better results, ranging from 72% to 91%. And luckily, we still see the best results with surgical mask, face shield together with surgical mask, and KN95 and N95. They all have particle reduction rates greater than 94%. We also compare the particle concentration we measure during coughing compared to the background level, which is before coughing. And we see, because to control the background level to minimize the particles, we reduce the background as low as 50 particles per cubic centimeter. And we see a significant increase at condition from 1 to 6, especially at 0.3 meter, they all see significant difference. And at 0.9 and 1.8 meter, there are either significant increase or a tendency to increase at 1.8 meter. So what we did is we subtract the background level, just try to get the pure PNC levels for all the conditions. And still we see the performance of the face shield is the worst compared to other face coverings, and the closed mask give moderate protection, which is way better than face shield, but it's not as good as surgical and KN95 and N95 respiratory. So we also look at the particle size distribution at the 3 locations. So first, let's look at the cough droplets without face coverings. So what we find is the cough droplets are mostly less than 2.5 micrometer. And this is lower than the previous studies, which report the cough particles can be higher than 10 micrometer. I think this is probably because our study room has a quite large dimension and with a well-ventilated flows, which could make the particles evaporate quickly and shrink into smaller sizes. And when moving to 0.9 meter, and 80% of the particles travel to the second location. When it goes to 1.8 meter, only 10% of the particles less than 1.1 meter can reach the further distance. So let's look at how effective the face coverings can reduce particles at different sizes. So first, for those face coverings with reduction rates less than 90%, we see face shield, those blue triangles. It's not effective to reduce particles at almost all sizes. And the cotton mask and the flannel mask, it has a better performance for particles greater than 1 micrometer, but not for smaller particles. And we also see at farther distance, some of the small particles are elevated at around 0.5 micrometer, and especially under closed masks and face shield. And compared to that, those face coverings have greater particle reduction rates, are having better performance showing a near background size distribution. So what we have seen, cough droplets are small, which can be suspended in the indoor environment. And for our protection, we see the performance has the best in N95, KN95, and surgical, and which is greater than closed masks and closed masks together with face shield. And face shield by itself, it doesn't provide a good amount of protection. And within 1.8 meter, and the N95, KN95, and surgical provide the excellent protection, which can substantially reduce the transport of cough droplets. It should be noted, even though the wide range of the efficacy, most of the face coverings can serve as a simple barrier to help reduce the cough droplets, and it can likely decrease the spread of COVID-19 if most of us wear it. So thank you for Administrative Vice Chancellor's Office at UCLA, and also Dr. Shen Q-Hee, who provide the technical support. That's it. Thank you for listening.